Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am RipsyTech's very own product manager, Parker Anderson, and as always, I am joined by the illustrious founder and CEO of RipsyTech, Tom Tarshis. Hey, Tom.
Hey, Parker. How are you, sir?
I'm good. I just told you right before we started recording that it is raining at about a 40-degree angle outside my house right now, so some cozy indoor times to look forward to. But yeah, otherwise, pretty good.
But it must be quite warm also, right?
It is. I live in Georgia, so it's about maybe 87 degrees and humid, but also raining at the same time, so... It's an odd paradox if you're from California.
Yeah, no, when I was in Michigan, we had those summer days. I used to love that. Like, it's pouring rain, but it's like 75, usually humid, but it's a new experience to be outside with warm rain coming down. Kind of fun.
I mean, honestly, when it's 87 degrees and humid, you don't really feel like going outside anyway, so it's like... You know, no skin off my back, whatever. Now it's just wet, so extra reason not to go out. All right, well, we have an interesting episode to cover today. We're going to be getting into the history of patient-provider communication and how it's evolved over the years. But before we dive in, I want to provide a great little update about RipsyTech and how we have this awesome How to Start a Private Practice course. If you are listening to this and you are considering whether you want to start a private practice, maybe there's too many question marks in your head, look no further than the ripsytech.com/practice website page. We have a super awesome course that we put together that just takes all the guesswork out of it. Go check that out again at ripsytech.com/practice. Okay, so for today's episode, like I mentioned, we're going to be getting into how patient-provider communication has evolved over the years. With your experience over the last 31 years of being in this industry, thought it would be good to talk about, what did it look like then? I mean, there's been a number of technological innovations that have taken place in the last 31 years, especially in terms of healthcare. So, thought, it would be interesting to discuss how have the dynamics changed in the last 30 years? What has changed in the past 30 years between patients and providers and their communication?
Parker, you were, I believe you were born, but we're maybe not walking yet in 1995.
Hopefully I was walking. I was born December of 1993. My son started walking at about 10 and a half, 11 months. So if that is anything to go off of, yes, I was walking in 1995.
Okay, very good. My oldest child was born the first day of medical school, so I always have this constant sort of connection between the birthday and medicine. But I think this topic was on my mind because our executive director, Dr. Sarah Herron, just signed our 5th new child psychiatrist who will be joining our nonprofit entity this fall. So right now we have 3 child psychiatrists and a MFT student is our clinical team. And it is about to maybe triple. We have 5 new doctors and also some other associate therapists and potential other employees. So what happens when you're, in addition to more support staff? So, when you're a solo practice, you sort of have your cell phone, but then as we're getting bigger, you have to think about where is the clinic going with its needs for communicating with patients. And I think that's what I've been thinking about a little bit, and thought it would be fun to take a trip down memory lane and see how things have evolved. So jumping all the way back
Yeah, let's talk about it.
And
1995. I don't know. I mean, I think what a lot of people look back on 1995 and they think about maybe AOL Instant Messenger. I don't know if that was part of like the teenage experience back then. It was part of my teenage experience in like 2006. But 1995, I think about, okay, maybe we had that technology, but texting, I mean, cell phones were maybe just coming onto the market. I don't even know. I'm too young.
yeah, no, what was, email had gotten pretty good then as far as speed of transmission. So from an email perspective, but what, right, the first cell phones came out in the kind of late 80s ish. Pagers, Parker, just not super relevant, but as part of the communication in healthcare history. Let's see. Do you know what year the pager was? What was the first hospital to use a pager?
Oh gosh, do you have that fact ready to go?
Only because I just was looking it up.
Okay,
or let's just go to the first big city that implemented a pager.
I'm gonna say New York in 1996 at the, I don't know, NYU Health. I don't know if that even exists. I'm gonna go with that.
Your location is correct. Gold star, 100%.
Thank you.
Your year is way off though, Parker. If I just said cell phones were the late 80s.
It's okay. So that was it, like, I don't know, 83 or something.
It was 1950.
No way! Whoa. Was it Morse code they were sending? What's going on?
Yeah, well, and this, so, and, going all the way back to, let's see, my ex-father-in-law was a neurologist and for the Mayo Clinic years ago. And so in the mid-50s to late 50s, you would have, when you were on call, you would have to be home sitting by your telephone in case, and the hospital would call you if you needed to come in.
Wow.
But a few years into that, that was the first sort of bulky pagers, which allowed the people on call to be able to go out or not have to sit by their phone the entire time, but still you had to maintain a certain distance to the hospital location. And if we jump to 1995, when I started medical school, pagers were the communication system within hospitals,
right,
and the training setting.
I think they probably stayed that way for at least over a decade. Past that, I don't know. I think about watching Scrubs, and I think they were using pagers.
Yeah, if we all the way through my training, which ended in 2006, pagers were actually if at your clinic or the hospital needed to get a hold of you in an emergent situation, it would go through a pager. So, initially we had dual pager, you'd had two pagers because you'd have a personal one and then you'd have the one from the hospital. And then, which was, unpleasant keeping both of them on your belt, but nice that your kid, if you had a kid in daycare, and it was a nice way for them to be able to reach you with an urgent situation to pick up your kid. It's also the era where you could still say, oh, I'm really sorry, my pager battery was dead, and avoid picking up your kid if you were stuck in some other issue. Not that I ever did that, but I know other people that did.
I mean, this is really making me seem super young, but just because I don't think I've ever seen a pager in real life. So my impression of what a pager is kind of like a line that just kind of goes by, where you have to catch it as it goes by, and it could maybe take a long time to read the whole thing based on the speed of it. Am I correct in that?
Well, I think you're thinking about the first sort of text messages. This was really, all it could do was send a phone number to call back. Right. That was the first pagers. Like
Oh.
it goes beep or it vibrates, and there's the number that you're supposed to call.
Oh. Interesting. Wow.
Yeah,
Okay.
and yeah, like before that, it was even before they could do full phone numbers. It was maybe there was a number, one digit, 0 through 9, and based on that, you knew the number you had to call. And
Okay.
then
Okay.
the first time I ever saw a cell phone in the hospital was in 1999 when the head of OBGYN forgot his pager and instead gave the hospital operator his cell phone number. And so he had his cell phone in the hospital. However, that did not work well back in the early days when cell phones were analog.
Mm-hmm.
And I don't know if it was true or not, but they're same as with on airplanes that somehow cell phone communications could cause a plane crash. There were worries about the sensitive ICU equipment or other stuff, and again, I don't know
Okay.
how valid
Interesting.
that all was. But signals weren't great on cell phones initially. Pager signals were much stronger for a long period of time, and I think that's why it really persisted to that, all throughout my residency and fellowship. So 2000 through 2006, it was pagers was how you were contacted by your clinic or the hospital.
Okay. So, we're talking about kind of internal operations, communication. What about, communicating with a patient outside of session at that time?
Yeah. So at that, those days, the only way a patient had to get a message to their doctor was through a telephone call, really, right? And there were answering machines, or depending on the size of your clinic or operation, like people to answer the phone and take a message. And then if it was an emergency or urgent situation, it was page the person or interrupt their session, which put a lot of pressure, I think, initially on front desk staff to know what's an emergency or what's not. And it also was hard on a lot of front desk staff because you could take the message and you could give it to the provider, and then the provider, busy day, writing your paper notes, want to get home, very easy to not look at the messages. And then the patient calls back the next day, your poor front desk person, assures the patient you gave the message. But there was a lot of extra abuse towards the people taking the messages at that time. But in the context of a very small group or solo practice, yeah, when I started back in 2007, I had an old school answering machine. That was sort of, yeah, if I wasn't there to pick up the phone, a message would go on the answering machine. And yeah, you'd walk in the morning and you'd be like, I hope the number of messages says 0 and on the little early digital screen, but it rarely did. And that was the communication. There was email. That I think the interesting thing is, like, right around the time when I was starting to practice in 2007, email had gotten pretty good.
Mm-hmm.
HIPAA had started in 2003 and then in 2005 for digital communication. So protecting patient records, 2003 with privacy, and then digital communication, 2005, even though the law was signed in 1996. But we didn't have things like, the BAA from Google, the Business Associate Agreement guaranteeing HIPAA. Google's didn't come out till 2013.
Wow.
So there were some earlier sort of email HIPAA providers that it was, not an awesome experience. I think when we started, phone was used a lot. I did allow, of course, use of email for some communication with a lot of caveats around what can be in the email, etc. And but it was very, and then going specifically for mental health, there's a long history of being very, not just mental health, but for all doctors as well, long history of being very secretive about, letting a patient have your phone number.
Okay. Okay. I mean, when did that, has that changed? I mean, I was going to say, when did that change? But has it changed?
Yeah. Well, and what's interesting, Parker, for, a Gen Zer like yourself. No, I'm just kidding.
I'm technically a millennial. I'm a young millennial, but I am technically millennial.
But I wonder, as a young millennial, like, what do you think? What do you think about that? Does that feel weird for
to like have my therapist's phone number, for example? I think it's weird. I mean, I don't. So I turned 18 in 2011. Graduated high school in 2012, and that was the first time. I think that was around the end of that year, around when I turned 19, was probably the first time I ever saw a therapist. And the technology, we had smartphones by then, but like, I don't know, for looking back then, it wasn't even, we didn't even have DoorDash yet. Like, that wasn't, that was kind of the era of like apps were just kind of all the rage. Everybody needed to have an app. So I don't know. It's kind of having that being my starting era of seeing a provider experience. It is weird. I think it is really weird. I think the first time I had a provider who was like, oh yeah, and here's my phone number, and then you can feel free to text me if you need to change appointment times or anything like that, was maybe 2021 or 22, and that still was pretty weird.
So, so do you remember for that first therapist, how did you communicate with them out between appointments?
I saw them through my community college's counseling services. So I think I would have just called. Well, first I called the community college phone line, and then I had to get connected to that specific department, and then leave a message, or just walk downstairs from the cafeteria to go tell the front desk person, like, "Hey, I'm not going to make this appointment," or something like that. Yeah. But I mean, I think every provider, even after that, I don't think I had my first like non-school affiliated therapist until maybe 2016. And that was just that was a phone call. Yeah.
Okay. Yeah. And so for patients trying to reach us between sessions, it was phone calls. And I got, pretty quickly got a part-time front desk assistant to kind of call people back and be there to answer the phone, which even today in the world of automation, our clinic is busy and we have a lot of requests, but there are at least 15 unanswered calls that are not spam calls daily that people don't leave a message or send an email. So there is something around mental health where people are in a crisis and they want someone to pick up the phone and talk to them.
Right.
And I don't know, for other professions, I'm not sure what it's like there. But on the days I'm not seeing a lot of patients, right now the main clinic phone number goes directly to me. And I enjoy answering the phone. And I think people are shocked when it's like, wait, you're a doctor so-and-so? Because I'm like, hey, this is Tom. How can I help you?
Yeah.
And as we bring in all these new providers, we will look to be having a live person
right
to answer the phone. At that time when we started, it was this, because of the veil of secrecy around mental health or not wanting to give out personal information, or everyone maybe had a horror story of a patient who stalked them and showed up their house. answering services, which are still common. We did get an answering service at the beginning, which was a great people, and you could sort of tell them, here's what an emergency is. An emergency is not, my 12-year-old is out of their ADHD medicine. That's not worth a Friday night at 11 p.m. phone call. And
Right.
it was a way to implement an extra sort of screening. Ultimately, though, if we're going to be responsive, the patient calling the answering service, calling you, and then either you having the answering service communicate something back, or then you calling the patient, you've just added a middle person to getting the issue resolved. Yeah.
I mean, well, okay, so, we're talking about like, text messages. I mean, so, for me, even in the last 5 years, text message is kind of odd, but like, I know, email, texting, telehealth, but I guess patient portals is kind of top of mind right now, because a lot of patient portals do have, two-way communication. And I imagine at some point in your career you've used a patient portal that had the ability for a patient to send a message through the portal. How is that factor in?
Yeah, and so personally, when I'm trying to reach out to my doctors, we have a portal option, or you can give a phone call to the clinic. And, the portal's nice for some things. And then if it's a very brief question that's not urgent, I'm very, as people know about me, I'm very oriented on making sure people get proper care. And then also around making patients feel welcome and respected. And I am not a fan of the portal messaging, because I feel like it limits what people can, right? The good piece about it is, if you as a provider have a hard time not sending back 5 paragraphs of information, then a portal is good on the provider end to force you to limit your response. And oftentimes when something should be hey, let's make a appointment to talk about this, sometimes people feel compelled to answer long emails, and that doesn't work well. And that's something that we work with our new providers about. I am really a big fan of allowing secure email access, because people communicate via email and text. Like, people will have a preference. If you add the portal, you're forcing the patient to do an extra login step. You're limiting what they can write. You're putting them in a system that's not their usual way of communicating.
That's true.
And I think it makes for a worse customer client experience.
Yeah, I mean, speaking from experience, I don't know if it's my age. I'm old enough to prefer talking to people on the phone in order to coordinate things. I just saw a new dentist in the past week, and I had to text them a picture of my insurance card in order to get that process done. And that, to me, was kind of odd. But I don't know. I mean, I don't know. Like, when I think about coordinating my care now, a phone call is definitely the most efficient way to make sure that whatever thing I'm trying to make sure gets done. But I don't know. When I think about, like, there's so many mental health, like, online services that exist now, like BetterHelps and Headways and whatnot. And those often come with their own communication features baked in. So it's almost like, the platform that I found my provider on is also, one I've already got a login for, and therefore I can kind of, shoot a message to them really quick. So, that has been convenient in some scenarios. I will say it would, I mean, yeah, like in that case, it's like I've already got all of the steps kind of figured out. So just like log back into that thing and I know how to find the page and just like shoot a message. I imagine the provider probably hates it. I'm not gonna lie. So
Yeah, like,
go ahead.
yeah, let's comment on the provider piece. So I would, I have a separate personal line and a separate, work cell line with texting as well. And the idea, I would rather just have the messages show up right away on my one device and not have to log into a portal. Even getting sort of a notification like you have a new portal message is not necessarily pleasant to me. And you don't want to have your portal sort of logged in and active all the time to see the message. The one comment about the sort of national online telehealth providers, of which there's a lot, I recently had a terrible experience trying to get in touch with a provider that we share a patient with. Mm-hmm. And the patient filled out a release of information and they didn't have anything because they communicate through the portal.
Yeah.
All they have is the phone number. And then, so that's what's on the form. So there's a very general email, a very general phone number. I sent the email saying, hey, I have a release. I'm trying to reach this provider. Like 10 days goes by and then someone said, oh, sorry, this went to the spam folder. I was like, okay, awesome. Well, and it's sort of, do you still need to talk to them? Yes. And I have a release, and can you please share their email or phone so that that we can connect? And they wouldn't give me an email or phone number for this provider. And so then in Tom mode, I went to strict Dr. Tarshish mode, saying, if I don't get the email or phone, I think the licensing board for this provider would like to know that there's no way for them to collaborate on care with their patients. Do you think I got a response back then, Parker?
I think you did. Yeah.
Yeah, I did. But what a hassle. And then for my patient to not actually know what a phone number or email is.
Yeah. I mean, come to think, I mean, I haven't seen a therapist in a while, but if I were to do some kind of like release of information for a new provider, I'm not really sure. I would hope that they would have like a phone number available if I logged into like Headway, for example, for that provider. But yeah, the truth is I don't really know. Or I think, I can't remember what I was doing, but I needed to provide contact info and for a provider I saw through Headway, and I was just like, it was complicated. I don't remember what the exact scenario was, but it was complicated. But I'm also thinking in terms of, Gen Z. I am a young millennial, so I am not Gen Z, but I think about Gen Z or Gen Alpha, and I feel like it's this this growing trend of not wanting to have to call people if you don't have to, or I don't know, younger generations don't remember how to do phone calls because they're just so used to having everything automated. Is that something that you've seen in your experience, or I'm just kind of spitballing?
Yeah, no, and so just to update on where we've landed at right now, we don't have an answering service, but people can text the main line 24/7. Oh. I see it right away because we provide good care. I don't think I've ever been disturbed very late in the evening for any type of issue, any urgent issue. As your practice grows, that might change, but I don't see the need for the answering service. I do think the text messaging even for the 40 at any age, it is convenient for patients to be able to send a text. And I've always felt like for providers, being able to respond via text or email, as long as you don't overdo it in trying to answer every question, which will just lead to a longer email, is more efficient than a phone call back, which can get, if in general, if you're kind, thoughtful, and responsive, people will see that, and it opens the door to more communication. And so for me personally, being able to text or email back, it is efficient. So, right now, all of our providers have, our patients have the secure emails for the providers. Each provider does have their own direct phone line that patients can text or leave voicemails. It's rare for the voicemails, and people. It's much more common for the texting, but I think it's works two-way with the ease of communication with the patients, that sometimes it's very nice just to be able to text back to your young adult patient. And however, for when you take insurance, or even if you don't take insurance, the insurance companies will only list the clinic phone number. So they may have your website, and they may have but the main, if you go to your insurance carrier and try to find someone, it's guaranteed the phone number for them is what's going to be listed there.
Like the phone number for the clinic is going to be what's listed?
Yes. So for new patients, the number one initial contact form is actually a phone call. Because we rarely answer the phone directly, the message does direct people then to our website and how to do an appointment request form. And there's here's the general email, and here's a contact form. But it is almost always a phone call first. And that goes down to, 18-year-olds.
Okay, but then after that, you're saying they are provided with a direct line to their provider once they've established that they are their provider?
Yeah, once someone's in and has become a patient, then they know their provider's phone number and their provider's email.
Okay. So, I guess with that being part of the operation, how do you set the boundaries over what's appropriate, via communication outside of session?
Yeah, and that's what you need to do trainings on with your clinicians. If you're a solo practice, or in a group, sort of independent, that's kind of up for you to decide. If you're running a clinic where there's work expectations, and for the health of your providers, you want to, one, make sure they're not spending a lot of uncompensated time responding to patients. And so it's education around, hey, this should really be a phone call or appointment, and it might be worth scheduling it to get compensation and reimbursement. Most commercial insurances do not compensate for email communicate. There are bill codes for this,
There are.
Some practices, I think anyone who uses a portal will see that you may be charged for this message. And that is if it takes a long time for someone to respond to you or do something, which there's a bill code for as short as 5 minutes. So for 5 to 10 minutes of digital communication, there's a bill code that you could be charged, that practices could charge you for. And other, like our pediatric group, where if you're a pediatrician, you have lots and lots of patients, and it's just not feasible to write long messages back to patients all the time, especially mainly around mental health for the pediatricians. So I understand why they need to put that limit there on patient communication. But yeah, so you made a comment about, you liked doing your appointments via telephone because you could sort of get it done quickly.
Scheduling the appointments, yeah.
The scheduling one is the as we're have our beta design and getting our portal ready.
Right.
To me, the most important thing, or best feature of the portal is for the patients to self-schedule, because it is often very hard when your clinicians have pretty full schedules. There's maybe only two appointments available, and then that can lead to well, we can't make those, and an uncomfortable conversation that often ends with someone staying later or putting a patient on a day or time they don't work. And so I think the scheduling and managing the billing and getting receipts and completing some questionnaires, that works very, very well. The messaging, we'll be doing some QI and research topics on portal messaging.
I have a question about, with this advent of, more easy communication potentially with your providers, was there, I don't imagine, okay, thinking worst case scenario, you've got the patient who is, maybe, not following the boundary of the communication outside of session, and they're like texting you a whole lot or something. Was there like a version of that existed before texting? Like, could your pagers be going off, or could the front desk who needed to determine if something was an emergency or not just be getting like, hey, you've got this patient and they are calling us nonstop? Was there a version of that?
There absolutely was. Yeah. So there were patients that would call, multiple times a day, every day. And it was to the dread of the front office staff. And then it was, usually the manager or head nurse would pull the provider aside and say, you've got to talk to your patient around, they can't call 6 times a day, and what's going on. And there were patients kicked out of clinics because they couldn't respect rules around calling and trying to contact providers. And
yeah, I mean, to a degree that makes sense, and it almost kind of speaks to like what's the, clinical case looking like if that is what's happening in the outside of session communication. Okay, but so I guess, so to a degree it's almost like it's still, things haven't changed, or like the behaviors maybe haven't changed, but the modalities of communication have. So I'm wondering, has the technology affected therapeutic relationships in any way? Have they gotten better? Have they gotten more complicated? Or maybe both?
Yeah, I feel like it is a both. I think it's very comforting to patients to know that they could actually reach their clinician quickly. Mm-hmm. That, hey, I can text my provider. They may not get back to me right away, but I know they'll see that, and then I've kind of communicated what's going on, and that they will get in touch with me within a certain time frame if needed. It's that treatment phenomenon where if you suffer from panic disorder, but there's a specific medicine that immediately, well, I can even use myself. I'm a migraine sufferer, but
rough.
I know that 800 milligrams of ibuprofen, if I take it right away, will abate the migraine. And so if I'm ever a little bit worried I might get a headache, if I know I have my little pill case with ibuprofen in it, it sort of makes the headaches not even come, because takes away that stress. So I think that patients knowing that their provider is responsive and they have sort of a text or easy email access actually helps them do better and be less likely to contact them, versus knowing if you feel like you're in panic mode and it's a barrier to get a response from your provider, that creates anxiety and stress, hurts outcomes, and I think does hurt the therapeutic relationship in today's day and age. I think the complications come with the fact that, hey, now someone can text you the night before and say, hey, I can't make it to my appointment tomorrow. So instead of, reaching out to the front desk, what if you don't have a front desk? Does that mean then as the provider, it's up to your clinician to say, well, that will be a $300 no-show fee. okay, but there's a no-show fee. And then, so having that sort of communication lines when there should sometimes be a front desk intervention, that requires then your clinician to be like, hey, can you text this number to let them know, or to be the, know the rules and explain them. And we want to protect our clinicians. Again, unless you're a solo practice, you want to protect your clinicians from things like imposing a no-show fee or late cancellation fee. That can also hurt the therapeutic relationship. But.
Right. I guess the only thing that I'm left wondering is, does communication, is it different in practice, or does it have to be different in practice, based off of, the type of clinical case or maybe the level of care that the patient is in? And I guess on the clinical case question, is that ethical to say, like, well, if it's, in this case, I am not comfortable giving them my phone number, but, in this case, I totally am. Like, is that a concern at all? Sorry, that was like a
it's like a great question. It's this sort of, I know this client's not crazy there, or
right. Like thinking in that worst case scenario, like, because people who are maybe like not attuned to the mental health system, and they hear about therapists and psychiatrists, and they're like, oh, well, there's that bias or the stigma that exists in their head of like, why would you ever give them your phone number? Because crazy people could be calling you or something like that. Is there any truth to that?
Yeah, well, and because technology and texting and communication advances are so ubiquitous, even with patients with bipolar or psychotic disorders, on some level, if you're their provider, you want those like messages to come in. It's a sign that your patient isn't doing well and you need to intervene. And
that's a point. Yeah.
There are like dialectical behavioral therapy. There are times with 24/7 access to the therapist, and that's part of the fee arrangement. And you want them to be texting you that they feel like hurting themselves instead of hurting themselves. And so there is probably if the policy is that people have access to the email and a phone number to text their providers, I think you need to implement that throughout their clinic. Are there exceptions? I think there definitely are, but I think we're to the point where, if one of our clinicians came and said, hey, I want to block the number of this patient from texting, we've got to have a good justification and put
Right.
that in the chart and explain why we're doing that.
That makes a lot of sense.
So I think you can always, but document it and explain the reasoning. And as long as it's ethical, reasonable, and good for their care, like, you're fine.
Okay. All right. I'm out of questions on this topic. Or is there anything else that you feel like you want to kind of put out there?
No, I don't know. We're doing some interesting AI things, thinking about AI for good and how it can help our patients, and what's coming, Parker. And so some CEOs are already doing this, where they take all their email, all their speeches emailed, and they create an AI character of themselves. And so I wonder, about do clinicians create, if you create an AI
Oh God.
of your provider,
Oh God.
Do you give them access to you in your pocket, in their pocket? It's interesting to explore and test and maybe pilot some things, but
Oh man, do you think? I'm just kind of speaking candidly out loud at this point, speculating. Yeah, do you think that there are companies that are thinking about that? Of like, can't get access to your therapist outside of session? Well, that's okay. In the meantime, you can talk to the AI chatbot version of your therapist, and they'll be able to review it later. I don't know. That actually terrifies me to think about, because then there's like maybe whole therapeutic breakthroughs that happened while I wasn't there as the provider. I don't know.
well, Parker, make the AI chatbot of yourself and put them in conversation and see if they can have the therapy breakthrough that they can just tell you, oh, here's what you.
Oh,
That-
like
you
I
know,
log in and AI me is telling me like, hey, by the way, this happened.
No. AIU is meeting with your AI therapist, and they go at it.
Now we're talking. Okay, yeah.
No, well, and we know there's a lot of interest and energy around therapy, AI therapists. I think that I don't think the AI therapists will catch on. A lot of people are going with AI with their mental health questions, comments, but
Totally.
it hasn't decreased demand. If anything, I wonder if it's increased demand for live therapists. So the pure AI therapist you don't know is one thing, but getting the AI version of you, or AI, hey, put Dr. Tom in your pocket.
I don't know
Yeah, I
about
wonder.
that.
I don't know. I don't know either, but
It's a little too out there for me, I think. I don't know. Like it's an interesting thought experiment, but it almost feels like the AI that you're talking to has to be kind of thought of as a separate entity that is not just the robot version of somebody, in order for it to I don't know, feel ethical. Like I would rather my provider, or I would rather my patient say they were talking to Rye or something, and Rye being like my AI therapist who takes my after hours calls, then the patient kind of create this parasocial relationship with me outside of session that is a relationship that is not with me. I don't know. It's
But what if it was hey, Dr. Tom, I missed a dose of this medicine. What do I do? So what if it was tuned to answer sort of knowledge-based best practice medicines like you would? But if it said, I was thinking about the meaning of life, and I don't really think it's just video games, Dr. Tarshis, and no to like defer that for the real session. But anyway, we should do, might be time for an AI session update on what is happening in AI and mental health.
Yeah. I mean, it moves so fast. So I mean, now that we've even just opened this can of worms of a thought experiment, now I'm like, wait a minute. I need to go look into this a little bit more. I think I maintain like it's got to be. It can't be just AI Tom. It's got to be something else. But like it's affiliated with Tom. It could be trained off of what you wanted to say. But anyway. All right. How about speaking of AI? Let's have a word from Rye, our AI mental health practice advisor.
This is Rye, your AI mental health practice advisor. Practice owners often ask, what's the simplest habit that improves a practice's cash flow? The simplest habit would be to collect your patient's balance while they are still engaged. That may be in session, at checkout, or immediately after the appointment when payment is expected. Once the patient leaves, the balance becomes another follow-up task your team has to chase. Collect at the same point in the workflow every time, use the card on file when appropriate, and have a clear, objective process for communicating outstanding balances. For more practice advice, ask me a question at RipsyTech.com.
All right, cool. So, Tom, you were kind of going on about something before we started recording. I don't know if that was a potential mental health business moment you wanted to discuss, or maybe you've got another mental health business moment on your mind.
Yeah, I mean, I think there's a lot. I think I have a feeling that, insurance companies are going to push on making it more difficult for mental health clinicians to get proper reimbursement for services. And we have these federal laws, and most states have laws to kind of for mental health parity and to stop this from happening. But the reality is that sometimes the systems themselves are quite, I don't know if broken's the right word, but so for example, Parker, if a patient has a complaint around how their insurance company has treated them, these are patients with mental health issues. So you're already stressed out by something you're dealing with or your poor kid is dealing with. The step one is often, insurance companies are mandated to have a complaint or dispute department, and you have to submit the complaint to the insurance company and wait for their 45 days for a response. And they're saying you have a problem with this health insurance company. Step one is let them know about it. Although I can see that at Nordstrom, the Target, yeah, you have a problem, tell someone live, like, hey, I bought this and it's cheap or it broke right away. I don't know, for healthcare, for companies that are for profit, billion-dollar institutions, telling the patient, oh, you didn't get a claim paid, or you had a problem with the provider or something with this behemoth company, well, tell them about it first. It doesn't feel right. Like, this is different than a return at Target or some other customer service. It feels like these are the people your issue is, and they're designed to make profits, and above all, they want to screw you, and you're supposed to take it on good faith that, no, my complaint's important. It just feels wrong, and it's dehumanizing for patients. And I've been frustrated with patients actually doing this and then being, sent, appeal denied, or I just haven't seen it work out. Like, we're really sorry this happened. Let's do everything we can to make sure you get the treatment you need. So I'm trying to figure out how to do things. What action can we take to do things better?
So is it, is it the fact that you have to complain to the insurance company before you can kind of make any more like formal complaint higher up the food chain, like at the government level? And that you have to, before we started recording, that's what you were talking about was, you wanted to be able to file a complaint at the government level, but in order to do that, you had to file the complaint with the insurance company first. But, let's say the insurance company doesn't respond, then it validates you going up to the government level. But if they did, and maybe if they solved the issue 45 days after it was an issue, or whatever, then that, I mean, in and of itself, the timeline is kind of crazy, but I guess, I don't know, if I had a problem with Target or Nordstrom, for example, and it was like, I don't know, something unethical happened, then I should feel like maybe, yeah, I can take it higher up the food chain than just Nordstrom. Or, I don't know, talk to somebody who's not Nordstrom about my issue with Nordstrom. I don't know. Am I on the
Parker,
right track
even
here?
your
Are
comment.
we talking about the same thing?
Yeah. Well, and we know in mental health, 45 days is an eternity. So if someone needs care, or is waiting for care, and all of a sudden, we see this with the appointments that come in, that if you don't get back to people right away, either things have gotten much worse in less than 45 days, or they've gotten a little bit better and crisis averted. So giving an insurance company 45 days to respond to a complaint about someone's health care, maybe in the old days when you had to mail everything, but come on, like billions of dollars of profits, patients can text. This is a place where we could use technology and make it 5 days. I'm sorry.
Right. We're not using pagers anymore. We got
not
patient
using
portals
pagers.
and text messages. Yeah.
Yeah. 5. They need to, if they're providing this vital care and these are they can raise their fees yearly dramatically. No, you put in place a mechanism. So in 5 business days, someone is an easy form to put in a complaint, and you deal with it in 5 days. And, if it's denied anyway, the 45 days is not, that would solve it, just cutting 45 to 5. If you're going to force it to go through the insurance,
right,
make it a reasonable time frame.
Right.
Yeah, anyway, it's just hurting patients. We just got to fight harder for our patients.
100%. I think anybody who's not the insurance companies can agree with that sentiment. All right, I'm gonna go ahead and wrap up the episode here. Maybe one of our longest ones, perhaps the longest one we've ever done. We'll see once we actually upload this. So I'm going to go ahead and say thank you for tuning in to this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you have any questions or are interested in being a guest on the show, that's not something I've brought up in a while. We haven't done a guest in a while. Please reach out at sitandstay@ripsytech.com, and whatever platform you are listening, please leave a follow, 5 stars, subscribe, comment, whatever makes sense for where you are. Those little things do go quite a long way towards helping out the show and helping other people who are listening, or other people who might want to be listening, find the show so they can start listening. All right, Tom, it was great discussing all of this today. It was a doozy, but it was fun. I'll see you next time.
Agreed. Thanks, Parker.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.